We hear a lot of perspectives on the Mankind podcast. Inclusion of a guest is not an endorsement of their views, and the opinions expressed here do not always represent the mission or values of the Mankind Project USA.
What if taking care of your health wasn't just about you? What if it was about everyone you love, everyone who depends on you, and everyone you impact every day, whether you realize it or not? In this kickoff episode for Movember, I sit down with Brian Heilman, senior researcher at the Movember Research Institute, for a deep dive into the real face of men's health, their groundbreaking new report that reframes how we think about men's health, not as an individual issue, but as a family, community, and social issue. We explore the caregiving crisis, health equity gaps, the myth of masculine independence, and why more and more men are lonely, disconnected, and dying too young. Brian brings the data, the heart, and real stories behind the numbers, and we talk about why growing a mustache in November might just save a life, including your own. This conversation is grounding, eye-opening, and deeply personal. If you care about the men in your life, this one's for you. Welcome to the Mankind Podcast. Hey, everybody, it's Boysen. Welcome back to the Mankind Podcast, the podcast where we are breaking the molds of modern manhood to prove that there is more than one way to be a man. And today I get the distinct honor. This is going to be our launch show for November. November is Men's Health Awareness Month, and it's also Movember. And the Mankind Podcast, the Mankind Project has been supporting Movember, has been aware of Movember for a very long time. And this month we get the opportunity to have 3 interviews back to back with different folks from Movember. My first is Brian Heilman. Brian, say hello.
What's up, everybody? It's really an honor to be here chatting with you, Boysen.
I'm totally psyched. Brian is a senior researcher at the Movember Research Institute. He's a researcher, a writer, and a team builder with over 15 years of international experience promoting positive masculinities as a driver of health outcomes, violence prevention, and care equality. And I don't know when the first time that you and I met. Probably it was at your research launch in New York a couple of years ago.
Yeah, I was excited to invite you also, boys, when we had that kind of meeting of the minds brainstorm roundtable around the new measurement scale or the index that we're trying to construct around how to measure healthy relationship with masculinity or healthy masculinities. So yours is a mind that Movember wants at the table when we're doing thoughtful work in these spaces.
Mike Myers, I'm not worthy. Thank you very much for that. I appreciate it. And I was invited, got the opportunity to be in New York City when just a few weeks ago Movember launched The Real Face of Men's Health, which I'm holding up on screen. You'll get a screenshot of that. Look for the links to that in the show notes down below. Brian and I are going to spend a bunch of time talking about The Real Face of Men's Health, their reporting on that. Yep. And so let's start with like a big question. So this report, a lot of what it comes down to, it's talking about men's health in a big scale, in a macro level, and it looks at it as a family and community issue, not just a men's issue. Why is it so important to draw that distinction?
Right. Yeah. Thanks for the question. And you're reading it exactly right. I mean, we titled the report The Real Face of Men's Health because we wanted to emphasize that the real face or the full picture is not just that individual man in a clinic or in a doctor's office. The real face is the face of everyone whose health is intertwined with his. The family members, the loved ones, the caregivers, the parents, the children. And all of us can think of people we care about in our lives, regardless of their gender identity, where when they're struggling or facing a real health crisis, the ripple effect, affects us. It's devastating, it's difficult, and vice versa. When we see them crushing it and thriving, we get a boost from that. And I think we just wanted to take on the issue of men's health with that awareness front of mind. There is nothing about this which is a men versus women issue. Our health is social. We all do better when we all do better. And so, as you'll see in the report, we lift up the experiences of caregivers and we emphasize the broad impacts of when men are doing well and not so well.
We all do better when we all do better. That's really good. Men's health is social. Health is
Yeah.
social. Health is intertwined. Yes. So in the book right here we are 38% of folks uh interviewed said that their finances have suffered because of caregiving, not
Mm,
roles as the person receiving care, but as caregivers.
right.
42% have adjusted their jobs to accommodate care responsibilities. 67% have taken time off in the past year to meet those demands. So
Yeah.
health impacts the whole system. It
Yep.
impacts all of us in the
Totally.
system.
Yeah.
Yes.
No, and I mean we wanted to, well, if you would have seen the screenshot Boysen shared, the book, this report is nice and thick.
It is nice and thick.
This is not a slight effort. And there are at least three major different buckets of data that we put in there.
Good.
A lot of it is like new, deep, sex disaggregated analysis of data that have been readily available, in the leading national health data repositories, but have never really been analyzed clearly in a sex disaggregated way. Like, a lot of this stuff is actually, even though it's there in the CDC data sets, it's never really been reported on in this lens. So that's part of it. We also did a survey of over 4,000 men who had been to the doctor within the past year. We wanted to understand their experience of actually seeking formal health care. What did they like? What were they satisfied by? What did they think could have gone better? How long did they wait before they went in? That kind of stuff. But the data you're citing from Boysen would be the third category, where we did a survey of over 2,000 informal caregivers for men. So in order to be included in that survey, you needed to be an informal, unpaid. We're not looking for,
Yes.
full-time paid professional
Yes.
care workers, a family member, a friend, an adult child, looking after a man in your life with a, diagnosed health condition from a long list of conditions that we put in there. And those caregivers are predominantly women, but they're not exclusively women. And so when you read the report, that particular chapter is full up of their own testimonies, their reflections on what it's like to carry the load of being a caregiver for a man they love. One of the findings that really stands out is just, the toll.
Yeah.
Women caregivers in particular, we asked them about 9 different aspects of their life. This is kind of what you're referring to, like your finances, your own social life, your own career. And women caregivers, by and large, felt like a net negative impact in 8 out of those 9 areas of life. The one area of life where they did not report a net negative impact was in the closeness and connection that they feel with the man they're caring for. The interesting thing is that the guys who are caregivers in the survey, they actually reported quite a lot of benefits in all those different categories in their lives. So it's a double finding. Like, we need to take seriously the toll that's falling on women. We need to not only think of care, however, as a burden, because caring for one another is the core way that we show love and show our humanity and our care, and our connection with people we care about. And even the women who are reporting challenges in those areas, they also feel closer and more connected. But there's also a finding there that, like, guys take pretty well to being caregivers, and that might push against some of the too easy
Stereotypes
narratives.
and too easy narratives. I like that. I like that framing.
Anyway, sorry for the long answer, but kind of setting up all of the riches of data that we have there.
All the riches of data and research, the Grant and Gluck study, right? The Harvard longevity study.
Yeah.
It just, there it is right there, right? So what makes a long life for a man is the quality of their relationships. How can caregiving actually enhance a life in some ways and kind of create closeness, create bonding? I think that's really cool. And that also suggests to me something. So as soon as I start thinking about families and family caregivers and women in families who are caring for people and the impact on broader community and extended family, it's immediately health inequities. It's
Mm,
immediately an equity question. So
mhm.
let's talk about some of the things that you found in terms of equity and inequity within men's health, men's care, all of that kind of stuff.
Yeah, no, I mean, and we take this really seriously. The second or third page of the whole report says like it's impossible to talk about this in the United States without an equity lens. And the, you know, quick back of the envelope definition of what that means is you just really want
Good.
to look to the communities where the need is the greatest. And what we show in our report is that from one issue to the other, there's no simple narrative either about like where the need is the greatest or which community is the most behind. The core principle is that wherever you are born, whoever you are, whatever your
Yes.
racial and ethnic background, whatever your income background, whatever your gender identity, you deserve to live a life of dignity and health and have access to high quality health care and to a healthy long life. Now, from one issue area to the other, there's different barriers there. Even taking a glimpse of men as a whole versus women as a whole, you can apply a kind of a health equity perspective. So we
Right.
do emphasize in the report some of the ways in which men's life expectancy is just really falling short.
Yes.
Uh, the
Yeah.
kind of the main headline of the entire report is, in a sense, an equity issue, which is that the majority of men in the United States die prematurely. This like
Yes.
shocked me when we dove into it. I was not like a mortality data researcher per se, so I had to really understand this, but there is a more or less a standard threshold of 75 years that
Right.
wealthy countries can use as a marker of like premature mortality. You're never going to have 0% of people dying before 75. There are tragedies, there are outliers, there are health risks that happen, but in the United States, fully 53% of men last year who died under age 75.
Yes.
And when you look at other wealthy countries, that's just not the case. Like our colleagues at Movember in Australia, where Movember was founded, they released their version of this report. And in Australia, 37% of men died under 75.
Hmm.
And when I tell you that the Australian National Health System and government regarded that number as like a red alert
Shocking. Yeah.
crisis, where tens of millions of dollars were immediately moved into a new men's health strategy and funding for different interventions, that was for 37% of men dying before 75. In the US, in the most recent year of data being available, that was 53% here. So there's a health equity issue about just being a man in the United States compared
Yes.
to other places. Then when you dig in, I mean, so prostate cancer has long been a key issue area for Movember,
November. Yeah.
cancer that affects the male body. And 1 in 8 men in the United States will be diagnosed with prostate cancer in their life, but among Black men, that number rises to 1 in 6. So that's another health equity issue where, you know, your racial and ethnic identity intersects with risks in a certain way where a certain amount of attention need be paid to the community with higher risk. But I think sometimes people are often, or at least the people um, who knows what their overall agenda might be, but there's maybe like kind of a knee jerk way to resist a health equity mindset, feeling like it's only about necessarily prioritizing racially or like racialized or ethnically marginalized communities. And yes, a lot of times that is where the inequities
Yeah.
show up, but that's really an incomplete picture. And a lot of what this report helps do is show how white men in the United States also are a community of disparity and falling
Mm.
behind in a lot of ways. White men are not the population with the longest life expectancy in the US. Asian American men and Hispanic men outlive white men in the US. But the area where it really jumps out the most is in suicide risk.
Yes.
So there's a chart in the report you'll see where the main finding of the chart is that suicide risk, which is of course a major men's health issue no matter what, but death by suicide is most likely to happen in younger ages, about like
Yes.
25 to 34, regardless of your racial identity. It's a most likely to happen to young men.
That one.
You're looking at it. You're looking at it. And it's
Yes.
kind of like it's a little faint to show up on the video, but what you see
Yeah.
is okay, the peak happens in those like your 20s and 30s. And then
Yes.
for every racial and ethnic group, the risk as you get into your 40s, 50s, 60s, and on, the risk goes downward, except for one group, white men. White men's risk of death by suicide stays high even after those younger ages and even spikes late in life. And we've also got a map of the United States that shows where suicide ranks as a cause of premature mortality. And the
Yes.
states of the greatest risk are the Mountain West, the Great Plains, places with a whole lot of white guys, to put it bluntly. And so this is one where like that is also a health equity issue, that there is something about white men, rural men, where the risk by suicide never really recovers after ages in your 20s and 30s. So I've given a multi-dimensional answer about equity. I'm sorry for going on again, but yeah.
No, I think that's really important. So, like, underlining for me, the data is really complex.
Mm-hmm.
There's lots to be taken from the data. And when we start to dig in, it throws even further into question some of these things that, like organizations like the Mankind Project and Movember are looking at, which is
Yeah.
like, oh, there's a whole lot of stuff that we take for granted.
Yeah.
There's a whole
Yeah.
lot of things that we don't question. And
Yeah.
there's a whole lot of things that go into kind of the formation and cultural map of manhood
Mm. Mm.
that can contribute to things like the suicide rate among white men
Yeah.
staying up here because
Yeah.
of what we're told we're supposed to get and what we don't get and what we are told we're supposed to be and what we aren't.
Right.
And that goes into another kind of aspect of the data that you pulled forward, which is that men underestimate and overestimate depending on what we're talking about. So that actually has a name, and I don't remember what the name of that is.
I love talking about this one. I think it's like it's kind of an evolution of the way folks like us who have been in this movement for 10, 20 years, I see it as a little bit of like an evolution of the way that we talk about how to transform norms of masculinity.
Mm.
Okay. And like the phrase that Movember uses is the perception gap.
Perception gap.
Yeah,
There
I
you
just
go.
love for your listeners to like think about this for a sec, because
Yes.
certainly the message that our field and probably a lot of your listeners have been engaging with for a long time is there are these restrictive ideas about what it means to be a man and about masculinity. Tough it out, walk it off, use your force to overpower people, be the breadwinner, we could all kind of quickly rattle off these man box ideas or these restrictive ideas. Right. Unfortunately, too many of us still heard those from influential men in our lives. Unfortunately, too often movies, TV shows are still reinforcing. Every time I still hear the phrase "be a man" on some TV show to enforce some of this stuff, it just drives me nuts, because it's 2025. We've been talking about this for a long time now. And we've rightly been saying, like, we need to help guys transform their relationship to that stuff, identify a different way to be proud of being men. And when we try to like put that into research and measure it, we measure the extent to which guys kind of agree with those ideas. But we've always done that in a pretty blunt way, where we just put those ideas out there. Okay, a real man should always tough it out. A real man should use force and we ask guys to agree or disagree. And on the surface, that makes sense, but there's kind of more and more of a consensus in the literature and the research about this that that's just fuzzy. And a lot of times what guys are telling you, if they say that they agree, is what they really mean is that they're aware of that idea in the world.
Yes.
They're aware of that. They've heard that. Somebody said that. Like they know that idea exists. But the way the questions are framed, the way that like guys actually talk about it after the fact, it's not always clear that that's a personal value that they individually hold and hew to. So what a lot of researchers have been doing more lately is like trying to just distinguish out, okay, there's a notion of a real man should always tough it out. A real man should delay going to the doctor.
Right.
To what extent do you think that idea is alive out there in the world? To what extent do you think guys around you agree with that versus you yourself think deeply, like, do you hold that as a personal value? And that's the gap, is guys will always overestimate the degree to which those ideas are popular and actually held as personal values to people. So we actually did this in the survey, and I hope the long explanation is making sense. Like, we asked guys, out of 100 men in your community, how many do you
Yes.
think believe, fill in the blank with a restrictive attitude about taking care of your health? And to a man, they are all saying like a higher proportion than when we actually go ask those 100 guys, how many of you actually believe this as a personal value? So, that's the gap. I hope that as we move forward and talk about this, we just draw a distinction of like, yes, we're aware that those ideas are out there in this, mass of a cultural notion of masculinity, but guys themselves are way less likely to really hold those as their own attitude. So
As their actual personal attitude, but then we act as if we're trying to match
yeah,
into what that projected
yeah,
expectation is. So in
yeah,
things like help seeking, right? Like,
yeah,
I'm going to sit on these symptoms for 9 days, for 12 days, for a
yeah,
month
yeah,
before seeking help because I think I'm supposed to tough it out. And
yeah.
that's what I project out into the
Right,
world.
right. I think I'm supposed to, rather than I strongly value doing that. Yeah, 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 yeah. That's exactly it.
Yes. Yeah, and I have fallen into that trap on more than one occasion. I don't want to make an appointment with my PC. I
Yeah,
don't want to. I'm just gonna sit
yeah,
this out. I'm
yeah,
just gonna wait.
yeah,
Yeah,
yeah.
and then end up in more pain.
It's a very relatable and common experience. Like, I don't know, psychologists have a fancy academic term for this. It's called pluralistic ignorance. Like, if any of your listeners out there have ever heard the term pluralistic ignorance, they're shouting it at their phone right now. Like, duh, Brian, it's called pluralistic ignorance. We know this. You think, but like, you can imagine all sorts of scenarios. Like, every human being wants to fit in. We are social creatures. You're out at a dinner party and your initial thought is always like, man, all these people have life figured out better than I do.
Right.
Like, their house is nicer, their car is nicer, their kids better behaved, whatever it is. And meanwhile, like, all of those people are thinking the exact same things about you. And just when you transform that notion onto gendering of masculinity, the same dynamic is there. And we need to just like help each other as guys see that, like, it's not actually real. I actually
Right.
agree with you. I want to take care of my health. I want to be here for my family when they need me. I don't want to have to tough it out all the time. Sometimes I want to cry. Sometimes I want to like be, like be, yeah, get a hug, whatever it is.
Yes. I um speaking at an event in New York City a couple of months ago, the way that I referred to that is this idea that we're all still going around. I didn't have the language pluralistic ignorance at the time. So, but there is a very, very truly American masculine thing of let's all just play make believe.
Yeah.
And we walk into the room with a whole bunch of guys and we're all playing make believe
Yeah.
with one another about how we feel, about what we're doing, about how we're engaged, about how we're killing it, whatever the
Right.
thing is that we're talking
Right.
about. But it's so easy to actually, and this is what you're learning, I'm sure, having these conversations, and we learn in the Mankind Project. If you just say, oh, can we stop playing make believe now?
Yeah. Yeah.
How are you doing really?
Yeah.
Guys want to go there.
Oh my God, they do. Yeah.
Men want to go there. They
And the
want
thing
to
is,
have
boys,
somebody to listen.
like, we're also far less often finding ourselves actually walking into rooms with people playing make believe. That happens,
Yeah.
but we spend all like so much more time scrolling on our phones through the perennial make believe of Instagram and Facebook and whatever it is. Like, every other person's feed you ever look at is all just you allow yourself that vision of make believe, or look how you're only seeing the most beautiful, best moments of people's lives. And it's kind of like an amplifier for this pluralistic ignorance thing. Hopefully we're starting to see that a little bit more, and encourage anybody to be real. Take the mask off even on your social media to the extent you can and feel safe to do that. But yeah.
Well, that's great, and probably a good segue into, so mental health and loneliness disconnection are a big part of the research, a big part of the report. Why do you think, or what did you guys discover about why men are struggling more than ever in these areas?
What's up, everyone? Brandon here. And, I grew up thinking hustle was the only way. I had to push through, grind, burn myself out, rinse and repeat. But now I know better. These days I'm chasing flow, that steady energy, sharp mind, calm focus. That's why I start every morning with Magic Mind. It's not an energy drink. It is a mental performance shot built to keep me level and productive all day. No crash. You can get your hands on Magic Mind when you go to magicmind.com/mankind50 and use code mankind50 for up to 48% off. When you support our sponsors, you support our show, and trust me, you will not regret it when you get your hands on this stuff.
Yeah, with mental health. So, I touched on the suicide risk. When you talk about mental health, it kind of means a whole lot of things, and there's a lot of conversation in media even about like the state of mental health right now. The sort of most terrible, tragic outcome is the permanent solution to a temporary problem that a death by suicide reflects. And men in the United States are about 4 times as likely to die by suicide as women. That has to do with a lot of factors, particularly just the lethality of means that men use when it comes to that point, because in fact women and girls actually make suicide attempts more often than men do. And I think it's important to emphasize that when we're talking about a mental health crisis at the moment, it is not a men's only thing. Like it's important to say, like, whatever markers, whatever survey you look at, women and girls are also having a rough time of mental health at the moment. So that's the honest answer, is we need to look after everybody's mental health at a present moment of a lot of uncertainty in our society, in our world, more of our lives on social media, which have the negative effects shared before, more disconnection after the COVID experience, and so on. I think when you take that as a reality and go deep into how that manifests specifically for men, not to prioritize that, just like like men's reality here is that when they're going through a hard time, guys just have fewer people to turn to, and they're less likely to do it, less likely to call a family member, call a friend, open up. I think women still, a variety of reasons, how they're socialized, the types of friendships that women across ages still report that they hold, they're able to kind of like vent to somebody, turn to somebody, open up more than guys are. So a relatively even mental health crisis moment just results in more of a feedback loop of isolation and despair and loneliness for guys. So there's a lot of richness to go into there as well, but I think we touched on some of it with our lives moving online, suicide risk, and so on,
which can be absolutely self-reinforcing as well. And when we, going into a different kind of therapeutic language, putting out bids for attention, bids for connection, bids for this kind of input, right? And the first time I get the rejection on that sends me further. The second time I get the reject sends me even further. And now we can go off into talking about the like seriously toxic kind of incel versions of that, or just, most men lead lives of quiet desperation these days. While scrolling on our phones.
Yes. Man, it's like such a crazy moment that we're living in, like just the social, and to be honest, like even I, in my personal, I do research on this like isolated man dynamic, but I feel it, like it resonates. I'm a relatively new dad with a 1-year-old living in the suburbs. I live far away from my closest friends in the country, and I find myself doing some of these things that I even write about in the reports. Like I listen to my podcast guys talking about movies or talking about sports or whatever, just so I can feel like masculine camaraderie around me, and have these, I don't know, like parasocial relationships with podcasters, or like that's just the reality of like desperation for social connection, that at least I have the lived experience of it as well as the
Yes.
survey data.
Yes. Figure 11. Percentage of men who often or always wish they had more people to talk about what's really going on in their life.
Yeah.
And the numbers here are shocking. 63% of men 18 to 24, 63% of men 25 to 29, 53% of men 30 to 34 often or always wish they had more people to talk to about what's really going on in their lives.
And the behind the scenes of a figure like that one, for the data folks out there, is that there was actually there was also an answer category in that question, which was sometimes. So like if you include in the guys who say sometimes, often, or always, literally it's universal. Like 95% plus across all age groups wish they had someone to talk with more. But you, out of responsibility, you present the somewhat more conservative choice of answers, especially when they still jump off the page like that one.
When they still jump off the often or always. Yes. And I was definitely aware of that as I was reading through it, is like, that's a shocking number. Those are shocking numbers.
Your listeners might have clocked, but if not, it's worth going back and finding. But the previous, what's he called? Surgeon General. The previous Surgeon General of the U.S.,
Vivek Murthy. We've talked about that. Yes, awesome. Absolutely.
Yeah. He's got the loneliness paper, and he's actually got the data to show that loneliness has an equivalent health risk of obesity or smoking 15 cigarettes a day,
right?
Which we kind of repeat in our report. There's also the figure in there that I've been talking about a lot. It's not from new to our study, but it's worth emphasizing. Is there was some poll that asked men across the U.S. way back in 1990, when I was in grade school, how many, just about their close friendships, and only 3% of men in the U.S. said they had no close friends at that point, 1990. And today, that poll was repeated, and it's 15% of men who say they have no close friends. So that's a number that I think I saw cited in that Vivek Murthy report. But that's 1 in 8. 1 in 8 guys say they have no close friends. So I don't know. Yeah, what can we do to make online spaces more conducive to authentic connection, to find those ways to get back offline and in community with one another? I have a little bit of faith that like younger generations are realizing that they've got to do that and they're finding the ways, but we'll have to see.
I also really appreciate a lot of the kind of feminist analysis that I've been seeing of that report and of this idea of the male loneliness epidemic. And let's point at like the strictures that we have adopted as men around what masculinity is supposed to be. It's like, let me keep hitting myself in the hand with a hammer and complain about the hammer.
Right.
Yeah. So we do
or
this
complain
to
about
ourselves.
The pain without,
complain about the pain without acknowledging it, without acknowledging that we keep doing this to ourselves in some way, and that there are ways out. And that's what the fact that the Real Face of Men's Health just launched in 6 nations around the world just is ubiquitous in the culture now in so many ways. And the fact that the Mankind podcast gets to engage in this way indicates that there are things changing. So how do you see that? How do you feel about that?
Well, I mean, yeah, it's tricky. It's always a double-edged sword, right? Because like it is, and we talk in the report about like all of us, the philanthropy sector, the government sector, just like in the hearts of the listeners listening to this right now, like to give ourselves permission to think about men's health as a priority area and understand that that does not mean turning the volume down on urgent women's health issues either. I mean, like that's why the entire frame is to emphasize these social connections and the positive impact and negative impacts that ripple out. Obviously, it's human nature to slot into this like binary thinking or black and white thing. So I always am challenging people, and you would have heard me at the launch event of this report. Like the facilitator asked me like, what's one thing you want everybody to do here? And I think she wanted me to say like, sign up for Movember, or, you know, like go do this with your mates or something. But mine was more conceptual, like get rid of this like binary black and white, zero sum, men's health means against women's health or vice versa mindset. Like push back on that whenever you can in your world. I think because like there are certainly every other week another op-ed about the state of young men, the crisis of
Right.
young men,
Right.
loneliness epidemic, manosphere, young men drifting more, you know, into radical political territory. It's like a major focus area in the media. I just want us to go about that conversation in a thoughtful, compassionate, see the whole picture, not just like a panic hand wringing kind of a view, not in a zero sum view. And for anybody out there interested, I think we walked that line pretty well in this report. You know, it's not everybody's favorite thing to go read, be assigned homework and go read a long report. But if you're looking for the ways to talk and think about men's health in such a way where it's not leaning into a whatever, you know, dark corners of manosphere view of
Yeah.
like men are the victims of the world, it's taking this issue seriously while not losing broader perspective. I think we walked that pretty well. What do you think?
I really think that you did as well. And I think that the whole approach to the release, as very public, as very affirming, as very interconnected, like that's what you
Yeah,
created with the space
yeah,
as you've been releasing the report, right? Is
awesome.
bringing stakeholders to the table, bringing practitioners to the table, bringing researchers to the table, bringing the medical field to the table, bringing corporations to the table, bringing Prince Harry to the table to
Yeah,
have a
we did that.
conversation about these things. And you
Yeah,
did that. Yes, right? um I think that that says something, is that can we have conversations about community health and look at women's health and look at men's health?
yeah, yeah, yeah. You know, can I share? I haven't talked about this finding anywhere, and I'm
Yeah.
trying to find a way to write it up. Maybe on Movember has a Substack also. Like it takes us a year to put together a huge report like this one, but we're also kind of
Yes.
more slow drip releasing little blog, you know, short essays, deep dives. And I've been meaning to write one about this, and it just gets at the just how zero sum worldview just is broken and doesn't, you know, necessarily reflect
Mm.
the realities of these things. So we did a poll earlier in the year in the US because we wanted to understand like how does this real face of men's health framing resonate with people? Like do guys appreciate messaging around like when your health is better, your family members do better, the community does
Mm.
better, it has
Yeah.
economic benefits. And I think we also were particularly interested in like do women appreciate that message? And we kind
Nice.
of probably thought like yeah, like maybe to a certain degree if we're really vulnerably honest, like we want to put forward that message because we want women to also accept and be interested in the idea of men's health, and maybe by showing how it impacts them as well it opens that door. But this is one of these cool experiences you have as a researcher where your like hunch or your sort of more closed-minded hypothesis gets blown up by the more beautiful reality, which
Oh,
is
lovely.
that when we and it's, you know, a sample of 1,000-ish in the US and a handful of focus groups, it's not the census data or something, but
Right.
from women we heard much more often like look guys, you don't need to like go out of your way to show me how this whole thing is actually good for me. I don't need to be told that like I'm gonna win somehow out of a men's health topic. Like guys are already kind of like trying to put other people before themselves. Like can't we just let it be important that too many men are dying too early from heart disease,
Mm.
from cancer, from lung cancer, from suicide? So the women are the ones saying like, you know what, I get it, but I don't really need the ripple effect message for me. But Boysen flip flop for guys value it so much. Like you tell a guy like, hey, you deserve to just like be healthy, period, so go to the doctor, it's good for you. That doesn't resonate as much as, hey man, look, your kid, your spouse, your, you know, coworkers, your buddies, your adult parents who need you to be a caregiver, they need you around. it's empowering and motivational to guys to think about what they mean to other people, and that when they're doing better, they can show up in the ways they want to show up for their family members. So of course we want people to also value their own health and go to the doctor, because you need to go to the doctor and be healthy. But sometimes it's the ripple effect message that is the nudge to get guys to pick up the phone, or these days, whatever, like go online and book your online reservation.
To do something, take
Yeah.
action. And that's, Scott Galloway talks about this in some sense these days, right? That is a provide and protect function.
Yeah. Yeah.
What you are doing is providing your family and your community with the healthiest version of you. What you are doing is protecting those that you love from you being gone.
Right.
On the like most fundamental level.
Right. And as long as that the viewpoint that you bring toward provide and protect is not a domineering force-based one, it's just like, hey, these people love me, I love them, I want to be around. I mean, the hard part about a stat like 53% of men die under age 75 is you're missing out on all of that.
That's
like it's grandfathers who don't get to meet their grandkids, and grandkids who don't get to, like, so like immeasurable years and experiences and spaces where guys could show up to be a loving family member, a carrier of family stories, and a powerful role model or influence to a younger generation that's lost by dying too young. So yeah, sorry to bring it to the heavy point, but that is a lot of the focus of the report,
and very real, right? And very personal. We lost my father-in-law 10 years ago. Suddenly, like absolute, like no idea, no indicator, no anything. But that is something that we've reflected on in our family over and over, is like all the moments missed. The times when the conversation turns, and this happened just like 2 nights ago in our kitchen, when the conversation turned and it was like, damn, I wish Dickie was here. This would be so much fun.
Oh my God.
To be having this conversation.
It's hard, man. Like, and this is like, it's difficult heart space and head space to put your listeners in, but like every single one of us have a Dickie or whoever in our lives we can think of who we lost too early, and that's the real face of men's health. That's that's a men's health and ripple effect story. My mom's brother, my uncle Bruce, I haven't talked about him in any of the events related to this report, but he's an example for me. This guy was like, if you were to see him, he worked 30 years in a heating and air conditioning like factory setting, like blue collar worker, like always in a tank top. Like his whole social community was at the bar down the street. He would, like, at a first his nickname among his friends was Mad Dog. So if you just like got the scouting report on this guy, you would think, all right, this is like super macho. But this was the sweetest, like one of the sweetest, funniest, most loving examples of a man I've ever seen in my life. And I'm lucky to be, among the older of my cousins. So I had a solid 40 years of a relationship with this guy. Even when I'm an adult and I'm married and I have my own kids, I still got a birthday card from Uncle Mad Dog every year on my birthday with a $20 bill in it. And he's got, 25 nieces and nephews.
Wow.
And nieces and nephews' kids who he did that for. And I can't say for sure that he wasn't looking after his health well enough or whatever, but like he fell asleep watching TV on his couch one night, and that was the end of it. He didn't wake up, and he was in his 60s, mid 60s.
Yep.
And so it's not just about the birthday cards or whatever. Like, this guy was a joy to be in the company of, and every Christmas, every Thanksgiving, every birthday party, I grew up in Wisconsin, every Packers game, we don't have him around anymore to make it all that much more fun. And, like, that weighs on my mom, his sister. It weighs on my grandma, his mom, who's still around and is a real survivor. And my mom and my grandma's pain from losing Bruce, is a men's health story, so that's the reality.
That is indeed the real face of men's health. Thank you for that. And you should absolutely expect to be in heart space and head space. You're on the Mankind podcast, for God's sake.
Yeah, thanks.
Brian, so we're going to be pushing for Movember this month. And what is the one thing? Is there a couple of things that you want guys to do? I will put the link to the report in the show notes. I'll put the link to Movember in the show notes. Is there anything else?
I mean, a lot of folks around the U.S. maybe have heard of Movember as like a prank that guys do for the month of November, where they grow a mustache. A lot of people don't realize that there's a nonprofit behind it that at this point is the largest charity in the world that's focused on men's health. The idea of the mustache is silly by intention. It was originally just a challenge among some buddies in Australia 25 years ago that hey, let's grow mustaches this month. We're going to look dumb. Our family members are going to tease us because we didn't used to wear mustaches, and they're going to not be the world's greatest, most handsome, strongest mustaches. And when you get teased or it gets brought up, it's a much easier way to have the conversation around men's health. Hey, have you thought about a PSA test or a prostate cancer preventative check? Are you aware about how testicular cancer arrives and how to check for yourself, especially younger men? Are you have access to the mental health resources and needs that are around, or that you could have access to? It's very hard to just go up to your buddies or your uncles or whoever and say, all right, time for the prostate cancer talk as the lead in. But the mustache works, man. The existence of Movember this many years later, and with all the global reach that we have, proves that the entryway that's lighthearted, that's a little cheeky, that's funny, works for guys. And so the core approach to Movember is sign up on our website, grow a mustache, take some pictures of it and update those over the course of the year, over the course of the month. Use the mustache as a way to start up conversations. Use it also as a way to fundraise for Movember's, field leading cancer research, mental health programs, and research like the Real Face report. And a lot of guys find that simply it's kind of a talisman on their calendar, or it's a nice little routine every year. I grow the mustache, I reconnect with my friends, I make myself a safe space for guys to stop playing make-believe, to use your words. So that's the idea. You can learn all about that stuff on Movember.com, how to sign up, where we all come from, obviously access the report. If anybody wants less homework, there is a summary version of the report. It's a lot fewer pages that you can also get. So head on over.
Thank you so much. And I think that you just did a trademarkable statement, 25 years ago. 25 years ago.
Did I say that?
You did.
That's so good, man.
So
the slip of the tongue.
You could definitely put that out. And I'm going to say, my wife is not looking forward to Grow the Mo.
Likewise.
She's just not. But I have a couple of public appearances coming up in New York City, and I will be sporting a really terrible mustache.
Dude, yeah, this is my bane, because the month of November is when I get the most media and speaking opportunities too. And then I watch the video back years later. It's oh yeah, there it is. There's the mustache. That's how it works.
That other thing. Yeah. Brian Heilman, thank you so much for being the lead off for Movember for us. I look forward to being with you in space and time again, and my prayer for you today is that you get a full night's sleep, and that your wife does too.
Thank you for the all of those with a nap transitioning baby or a sleep regressing baby. Solidarity. Thanks, Boysen. This was a really cool conversation.
Have a great day.
Bye.
This has been the Mankind Podcast, produced in association with the Mankind Project USA. And of course, I want to thank you, the listener, because through your attention and your support, you make it a heck of a lot easier for us to let men out there in the world know that they are not alone and that there is more than one way to be a man. And if you've been enjoying the music throughout this episode and all of our episodes, check out Jim, Donovan, and the Sun King Warriors. I have links to them in the show notes. Now, the fee for this episode is simple. If you found gold and insights that you believe could benefit your loved ones and those you care about, be sure to share it with them. And of course, remember that life doesn't happen to us, it happens for us, so long as we rip the pen out of fate's hand and become the author of our own story. So my friend, pick up the pen and we'll see you next week. Lots of love.
Hey, it's Boysen. On the Mankind podcast, we've brought some incredible guests on to talk about the importance of doing the work to improve our mental and emotional health. And here's the truth. Multiple times over the last 25 years, I've had the help of one-on-one work with some amazing therapists. For me, for my wife, for both of us as adoptive parents, and for our kids. The Mankind Project and Men's Group, though awesome, are not a substitute for professional mental health support. And so I'm thrilled that the Mankind Podcast now has BetterHelp as a sponsor for the show. BetterHelp works online. It asks you what you're working on and then matches you for live one-on-one sessions with a licensed therapist, someone trained to work with you, listen, and offer helpful insights. I'm using BetterHelp. It's super easy, and I like what I'm getting. If getting one-on-one support in the comfort of your own space feels like a good direction for you, I invite you to check it out. Go to the link in the show notes or betterhelp.com/mankind. And if you sign up, you'll get 10% off your first month of therapy.